Smile is a newer laser eye surgery that corrects nearsightedness without cutting a flap in the cornea. Smile stands for Small Incision Lenticule Extraction. It reshapes the clear front of the eye, called the cornea. In nearsightedness, light focuses in front of the retina, so distant objects look blurry. Astigmatism causes uneven focus. Doctors consider Smile for adults over 18, with a stable prescription, healthy corneas, and myopia within approved limits. Before surgery, the eye is fully mapped. Corneal thickness, shape, tear film, and pupil size all guide the plan. On the day, numbing drops go in the eye. No injections, no general anesthesia, and the patient stays awake. A femtosecond laser then shapes a thin disc of tissue, called a lenticule, inside the cornea in under a minute. The surgeon removes that disc through a small opening, just a few millimeters wide. The cornea settles into its new shape. Unlike LASIK, no corneal flap is created. This preserves more surface nerves and often means less dry eye afterwards. For the first day, vision feels hazy and eyes may water. Most people rest at home and see clearly by the next morning. Within a few days, many return to work and screens. Vision keeps stabilizing over 1 to 3 months. Dry eye, glare, or halos can occur early on. Rare risks include infection or a residual prescription needing enhancement. Smile does not treat farsightedness or presbyopia. Reading glasses may still be needed as the eyes age naturally. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.